to the world. Subscribe now to the Hot 97 YouTube channel. It's Ebro in the Morning with Laura Stiles and Rosenberg.
I'm calling this segment All the Options Suck. We're about to have real vaccine talk.
Oh, man.
All right, on Ebro, Laura, and Rosenberg. 800-223-9797. Have you gotten the vaccine? Do you plan on getting the vaccine? We would like to hear from you. I was a part of a conversation yesterday. There was some serious vaccine talk with some influential people. And got to ask some serious questions, and it was communicated by me and others because it was specifically about black men and the vaccine.
Okay.
Because there is a push for black people, black men specifically, to make sure we get vaccinated. You know we don't trust that.
That's a fact.
Why now do you care about me getting... Why now do you, the government, care about me? Let's have...
Right.
End of thought.
Well,
why now?
It's higher in your community, so we want you to get it first because
You know what else is higher in my community?
Speak on it.
Unemployment.
Yep.
Police brutality.
Facts.
Joblessness. Homelessness. Mental health issues.
Food deserts.
Drug
Food
issues.
deserts. Drugs.
Oh, it's real high in the community.
All of that's high. And y'all didn't care about that. So why you care about this? And guess what? Those other things, they kill you too.
It's a fact.
Nah, you care about this because black people, black men, brown men, women are the essential workers. And we can get the economy going again if we're vaccinated and we can get outside and start moving around again. So you want us to get it. Now, clearly they've prioritized, hospital workers are already getting it. Elderly people who are staying in old folks' homes, and those workers are getting it. They're getting it now. They're getting it first. But right after that, they're like, hey, black men, black people, we need y'all to get vaccinated.
And there's other reasons beyond that, too, that could also still be selfishly motivated. Not just frontline workers, but also basically we need for this to be effective, everyone to be getting vaccinated. That's really the goal. And we also know that the black community has been disproportionately affected.
But we've been disproportionately affected because of the other factors I just brought up before
no.
the vaccine.
And there was no attention paid to those things. So it's like,
Well, they're not worried about those things. Those can't affect them.
And that's why that's on this conversation, we were having this convo, and that's what we were saying. So you expect us to trust you now?
right.
No. The mistrust is logical. It's just, is it going to benefit you?
So that's why I started this by calling the segment All the Options Suck.
Right.
Because the one thing for me is I'm not anti-vax.
Okay.
But, for me, vaccinations are like one of those things you don't just rush out and get. You kind of kick back and see how this plays out. And the other piece of it is, frankly, if you can't tell me whether or not this vaccination keeps me from giving the virus, because that's the thing about this virus, right? You can have it and not have any symptoms.
Right.
And give it to someone and kill somebody.
Correct.
So that's the big one. That's the big piece for me. So tell me, if I get this vaccine, does it prevent me from spreading the virus? The answer to that
Here we go.
is they don't know.
And that's the issue. As you stated before, they're trying to figure all of this out as they go along, yet still pushing aggressively towards the black community. So if you don't have it figured out, but yet you're still pushing it to me, I feel like a guinea pig.
And then I add to that. I do believe this, though, strongly. If you have a family member that has pre-existing conditions and they need to build up an immunity, this vaccine that is out, what they are giving you is a protein from the DNA of the virus that your immune system will learn how to beat. Thus, if you are exposed to the actual virus, your immune system will attack that protein in the DNA and make sure your body stays safe. That's the way I understand this vaccine. If you have an older person, a person with pre-existing conditions in your family, in your house, in your community, they need to get this vaccine.
An older person.
Yes.
I would be, and I understand that concept too, but I would be a little more concerned because they're saying anybody with a compromised system can be affected, even same way by the virus, same thing with the vaccine. So I would be more nervous for my mother to get injected with the vaccine at this point, even though she's older and could be compromised, because I'm afraid.
And that's why I started this segment by saying all the options suck.
Right.
Because if you don't get the vaccine and she gets the virus,
Yep.
if you do get the vaccine,
and then, her body can't accept this new.
and that's why I said all the options suck.
Hey, both those options suck.
So which one do you do?
And that's a decision that you have to make as a family. And that's why this is a serious conversation. Cass One, where you at with your parents in the vaccine?
I don't know. Right now, they're in a wait and see pattern by their own choosing. You know what I'm saying? Like,
What are you and your sister and your siblings saying for your parents?
we've had discussions with them to see where they stand with it. And right now, my parents are like, well, we'll wait and see. We've made it this far. We'll wait and see what's happening. Not saying they won't get it, but at this point, they're not going to rush out to be the first online to get it. Is what they're saying.
Can I offer one thing?
Of course.
And by the way, Breeze, I told we have a lot of good callers on hold too. But if you're curious about what's going on in the upper middle class white world, people are getting it. They can't. Everyone I know in my family circle, it's when am I getting it? I'm getting it. I'm getting it. So I'm not saying that should influence.
But it does help. It does help some people.
Yeah, it does help.
It does help.
That's just so what I've been told by everyone. My parents can't wait to get it. They're getting it. They want to get back out. They want to live their life.
See, because for the trauma that I believe many black people, and I can't speak for all black folks, but many black people, it's why you coming to us first? What's really good? And if you didn't come to us first, how come y'all not coming to us first?
But we're
And by the way,
we're used to not being the ones that get
Exactly.
things like this first. That's why it's funny. You're like, wait, what? I get this. Wow.
So how about this too? Here's what makes it complicated.
Yeah.
These things are not mutually exclusive. It may be BS that they're coming to the black community first. It may be, and likely is, because they want it to benefit white people. However, that doesn't mean that getting the vaccine is not the move.
For sure.
And I believe it likely is still the move.
And that's why I started this convo by saying I believe all the options suck. Because of our trauma, our distrust, there's a lot there. So, Rosenberg, you're getting the vaccine.
Yeah, when I come up, I'll go get it, why not? I feel comfortable that, listen, I've gotten other vaccines in my life. You know what I'm saying? Like,
We all have.
there are people who don't like the flu vaccine. And I've had a lot of people tell me, oh, you don't get the flu vaccine. I've had years when I've gotten it. When I heard the flu was really bad this year, I went out and got it. Everyone's, I've had times when I didn't get it. Yeah, man, I'm going to do it. And I want my parents to get it for sure, because for all of us out there who have parents who are lucky enough to have parents around in our 70s, they're in good shape still, and they're missing prime years of their life not being able to leave the house, see their grandkids.
Now, I do know some wealthy white folks who ain't getting it. Who are like, nah, I'm waiting.
Are
They're like,
these
nah, I'm not with it.
What age range?
They're in their 40s.
So they don't feel particularly at risk.
No.
Because my parents feel at risk.
Yeah. But like I'm saying, your parents are in their 70s.
Right.
And I believe that is a real conversation. Look, for me, it is, if I get this vaccine, can it prevent me from giving the virus to my loved ones?
Because that would be the main reason why you take it.
Well, yeah, because I don't, as far as pre-existing conditions, like, I could have already had the Rona.
Right.
I haven't felt, this is the best I felt in years this year. And I was on an airplane on March 13, 14, 15. You know what I'm saying? Like, now I wore a mask and had gloves on and, was disinfecting everything, but I walked through the airports, was at a photo shoot in LA in early March. And you know what I'm saying?
Mm-hmm. I mean, let's assume that the vaccine is effective, that you can't catch it, right? You can't catch the COVID virus if you have the vaccine, so therefore you wouldn't be able to spread it.
Well,
no, but you can catch it.
They didn't say you can't catch it. They said it'll prevent you from getting sick from it.
Correct.
So wait, you get the vaccine and you can still
get it,
contract the COVID-19.
But your body then fights it. Your body See, the way your immune system works, it's like muscle memory. Your immune system, you're getting bacteria all the time, and your immune system's like, oh, we know what that is. Knock that out of here. Oh, we know what that is. Knock that out of here. But then when you get something that your body don't necessarily know what it is, it's got to learn it. And when you're in that learning process, that's when you get, soreness and fevers and all of the things you get when you get quote unquote sick. But your immune system overcomes it. Mm-hmm. And then the next time you're exposed to it, your immune system's like, get out of here. We know you. Knock them out the box.
But that doesn't mean you can't get it. It can be in there.
Right. So you can catch it. Your immune system is strong enough to fight it so that you don't have detrimental results.
Well, exactly.
But if you have it and it's highly contagious, then I would assume you can spread it then. You know what I'm saying?
That's why everybody needs to get the vaccine. Like, so in your immediate circle, Ebro, so if your immediate circle, like taking your theory where you go, well, I want to know if I can't spread it. So theoretically, what they want is for you to get it and everybody around me to get it. So even if you spread it, it won't matter.
There you go. That's the talk. Who we got on the line, Shawnee Culture?
Yo,
we got people who got the vaccine. Anybody that got it?
Yeah, we got Chris.
Chris.
What up? What up, Ebro? What up, Rosenberg? What's going on, everybody?
Yo, Chris.
Chris, did you get the vaccine?
Yes, sir.
How you feeling? Tell us about how did it go? Like, what was the process?
It was good. It was cool. I went. It was just me. I'm a healthcare worker, so I went to this place by my job, and we went. Just got the shot. They make you sit there for like 15 minutes just to monitor you, make sure you don't have any adverse reactions, and then after that, you're good to go.
And so, do you have to? And you only got to get one shot, or do you have to get multiple?
Well, I got my first shot. You have to get two. I got the Moderna. So you get the first shot, and then between 27 and 30 days, I believe, you have to get the second shot. I chose 28 days. So
very good. And so now obviously you're still wearing a mask when you go everywhere and that sort of thing because you can still carry the virus.
Yes.
But now you don't have to have the fear of potentially getting deathly sick from the virus.
Exactly. And it's like, besides a little soreness in the arm, I'm cool with that,
Yo, Chris, I have a real quick question. So you said you took the Moderna one, right? Do they give you an option whether to take Moderna or Pfizer, or is there a reason why you got Moderna instead of the Pfizer?
So they were offering the Moderna. I didn't hear anything about the Pfizer, so I didn't really have the option. But if I had the option, I definitely would have gone with the Moderna just because, from what I've heard about the Pfizer, didn't really trust it. They didn't really want to get the vaccine at all to begin with. But, my mom, she works in healthcare as well. And we all got sick in February. And I spoke with a infectious disease doctor who said that, if you get it, if you get it and you get through it, the second time you get it, it might be worse. So I was like,
Okay. Well, thank you for that intel.
It's an interesting viewpoint.
Tammy on line 6, she was actually, I believe what I'm reading here, she was a part of the Moderna study. Tammy.
Hi, good morning.
Tammy, talk to us. You were a part of the Moderna study?
Yes, I was part of the Moderna study. I started in October getting my first shot, and then about 30 days later, I got my second shot. I find out tomorrow whether I got the actual injection or if I got placebo.
Got it. And you participated in this study. Tell us the whole process for you and your thought process and what you've learned.
I am a biracial woman. I'm 40 years old. I am fortunate enough not to really have any health issues. I don't typically have reactions to things. And as a person of color, I knew that it was important for us to be represented in this study.
Love
because
that.
I knew that we weren't going to volunteer because of the history and things that were done to us in the past. So I wanted to jump in there. I mean, I work in healthcare, but I'm not clinical, so I just wanted to do my part, in any way possible. So I volunteered.
So, Tammy, talk me through my psychosis and trauma. I'm not anti-vax at all. I believe, vaccinations are necessary. But there's a piece of me in this whole rollout that's like, why y'all so concerned with talking to black folks now? And I mean,
Well,
I don't like that I feel like that, but that's the truth.
We as black people have every right to feel like that because of what has happened to us historically. But I knew that there would be a lot of us that felt like you, and that's one of the reasons why I jumped into this study, because I knew that typically medically I don't really have reactions to things, and I wanted to make sure that we were represented because, if people of color aren't in the study, how are we going to know how we react to this vaccine? We need to know how our families are going to clinically react to getting this vaccine, to having it in our bodies. What it will do, to black people. Our people during COVID-19 were being hit the hardest.
That's right.
We need to end this. We have to do better. So that's why I was part of it. So I go tomorrow to Hackensack University Medical Center, and they're going to unblind the study, and I'm going to find out whether I got the COVID-19 vaccine or if I got the placebo. If I got the placebo, they will offer me, getting the injection. If I did get it, they're going to give me a card, and I'll be able to show, yes, I have already.
Oh, wait. So, that's something that people need to know. They handing out vaccinated cards with this joint. Is that for everybody that gets vaccinated? You walk out of there with a receipt?
I'm not sure. I know that Moderna is doing it, but I really don't know, what they're doing for Pfizer and such, or
Okay.
I don't know.
And you will get if they only gave you placebo, you will get the actual vaccine.
Yes, I will.
All right. Thank you for sharing.
Thank
Thank you for sharing. And please call us back and let us know if you don't mind.
We got Larry on the line.
Larry was offered the vaccine. Larry.
La.
Larry.
What's up, family?
What's up, fam?
How we
So talk to us about the vaccine,
here,
bro.
man. Let's talk about it. So I work for the Department of Public Works and in New Rochelle, let me be exact, where they say was the epicenter of where the spread started, per se. Okay, so now what they did was, I guess they must have been sitting on it, because all of a sudden they gave DPW a call. Oh, you guys came up, you could be vaccinated. The school system, oh, you guys could be vaccinated. So, they offered me the vaccination, and I agreed to take it. And then once the time came, as the hours start dwindling, I start having all types of thoughts going through my head. Then I start realizing, for me, that nothing has really been proven in regards to whether or not it's safe, whether or not it's effective, whether or not they even got the vaccine straight enough to catch whatever new spread is out there. Because, first of all, we behind the 8 ball. There's a whole new spread of COVID out there that they trying to find out.
Well, Larry, the vaccine, the remix that's out there, the Rona remix, the vaccine works on that. So they do know that. They know that.
So they say. So they say.
But, it's also, and that's why I started this segment by saying all the options suck. It's also, they say, guys.
Right.
We're living in this, and we're in it right now. All we got is what
and
they
that's
say.
the problem.
But can't we?
All we got is what they say. So you got to think about it. Here we are. This is January 2021. They started working on this joint per se maybe March of 2020.
And that's but by the way, that's a falsehood too, man.
That's not true.
That's not true. The different coronaviruses have existed before. This is the 2019 version of the coronavirus. There's been MERS, there's been SARS, there's been other respiratory coronavirus type viruses, and they have been working on this delivery mechanism for over a decade. They all they did was expedite it to market so that we could get it. They didn't expedite the actual technology of what the vaccine is. They didn't. That wasn't expedited.
Ebro, let me ask you a question. If they've been working on this vaccine for, per se, a decade or so, okay, why was it never something that they pushed for us to get? Our kids get vaccinated for measles.
Well, normally, from what I understand, and by the way, this isn't my area of expertise. I've only been reading and listening like everybody else. From what I understand, normally it takes a vaccine can take upwards of 3 to 7, maybe even 10 years to get approved. The reason they approved, remember, they approved this very fast, was because of the amount of people getting sick and the amount of people dying. So it was the approval and the testing that was expedited. Listen,
I appreciate the sentiment of the caller. I really do. And I also am trying my best to be empathetic to the black experience that I can't identify that totally justifiably has a mistrust of not only government, but the medical world. At the same time, every time we say supposedly or they say, and we get hung up on they say, Ebro, our whole life is based on they says.
That's right.
Every time we go to a restaurant, every food we put in our body, everything we're doing, every doctor's appointment we've had is they says.
That's right.
You know? So it's just interesting because you'll have people who are not willing to take this vaccine.
File this under the devil you know versus the devil you don't.
Yeah. And sometimes, Ebro, they don't even really know that devil either. So you're scared of this devil, but the black and mild every day, or the pack of cigarettes, or the vape, or the weed, or every other devil, you're comfortable with that, even though you really don't know that.
Well, because they see other people doing it, which is why they got people out here on TV, the black doctor, the black nurse giving the injection to the black woman, because they wanted to be familiar.
And that part is I'm uncomfortable with that.
And the other thing too is, like, even with they say, there's with certain things there's a certain amount of research that you can do. Because this is brand new, it's hard to just go with let me jump into this. This is a matter of life and death. So, yes, our whole life is in a space of like we go on what they say, but you can research. This is completely brand new to the public. People are dying. Who wants to put their life at risk so easily? Why would you take precautions?
And that's why I said all the options suck. Is because you said, quote, who wants to put their life at risk? Right. All of our lives are currently at risk.
All the time.
But that's the part that irks me a little bit, Ebro, if I'm keeping it a full buck, is let's take Shawnee, for example.
Mm-hmm. Please.
Shawnee is skeptical of this vaccine situation.
Mm-hmm.
But Shawnee was also skeptical, Ebro, about the masks. So I'm not saying you were like anti-masker. I'm not saying you're anti-masker.
Skeptical to the degree of their effectiveness.
Skeptical to their degree of effectiveness. And I remember you and I fought on the air before because you were using a bandana, and I'm like, get a real mask. So my point is this.
Right. I'm not anti-mask.
No, you're not. No, I'm not. Shawnee is not an anti-masker, but you're. It's
He's
like
a
you were
skeptic.
But you were my doubts on things.
But skeptical. I thought the skepticism around the vaccine is because you're trying to be preventative with your health. But you weren't so skeptical of COVID that you wanted to jump and wear a mask. When the possible downside of a mask wasn't bad, it was wearing a mask.
Remember, at the top of quarantine, I've completely changed my diet and built up my immune system in a completely different way that the average person isn't doing.
All right, calm down, Superman.
I'm just saying.
You're having some green juice.
All natural.
I'm just saying.
Not mean anything.
I've only eaten raw food for about 9-10 months, predominantly. I've completely rebuilt and restructured my whole thing because there was something floating in the air. So I'm not necessarily anti-mask. It's just I went with other ways of preventing myself from getting sick so that I wouldn't be contagious to other people and so that I wouldn't fall,
But that is a complete whim you went on.
That's not a whim.
Yes, it is. I'm going to have green juice and nuts, and that's going to prevent me from getting. I mean, I
And
see
salads,
the logic.
Yeah. Well, you're taking the vaccine to build your immunity.
But
So why wouldn't I build my immunity?
No, it's not to build your immunity. It's to teach your immunity a new trick. Different.
There's no teaching your immunity a new trick.
Yes, there is. That's what the protein does.
It's making
Yes,
your
there is,
immunity
Tony.
100 as much as it can. Yes, it is. What are you talking about?
Your body's learning your body is learning a new thing with the vaccine.
So
it's
you want
learning something.
You want to strengthen your immunity.
Yeah, you guys are saying the same thing, but you're exposing your body to something it hasn't been exposed to before so that your body can learn the protein in the DNA of the vaccine.
So is the better
and so
way
that
to
then if you are actually exposed to the virus, your body says, I know what this is.
Mm-hmm.
We already beat it. We have the math for this. We did the knowledge already. Let's get it.
So is the better way to continue to contaminate your body with poisons that
No,
deplete
no,
your
no,
immune
no,
system
that's not what he's
and
saying.
just wear a cloth over
I don't-
your
No,
mouth
no, no.
as a means of protection
Look
from
at it.
some poison in the
Shawnee,
air?
look at it like
No,
this, right?
you guys are
What
all
he's
saying the same things. It's just that what Rosenberg, sorry, Cass, because I want to get to Chris online too. What Rosenberg is saying is because when you're skeptical of everything, okay, including the things that are already keeping you safe without you taking a vaccine, it's psychotic in a way. Because it's like, wait, you were skeptical of the thing that was just didn't require you to do anything to stay safe, but you're also skeptical of the thing that they're saying this could actually help you beat it.
Right. Because
That's all he's saying.
Right.
Right.
Because I don't know what it is.
But what it comes down to is you don't want to put something in your body that you don't know what it is. You would rather just eat a bunch of vegetables and drink water and hope that your immune system is so powerful it'll beat it anyway. That's what you're going with.
I prefer to
and
build
you're
my
going to wear the
immunity.
mask so that you don't want to give the virus to someone else, even if you're a carrier. Because that's the thing. Remember, you can have the virus, have zero symptoms, not get sick, and if you don't wear a mask, you could kill somebody else.
Right. If you have it and you're spreading it.
Right.
100%.
So let's go to Chris on line 2.
Oh, he's gone? Yeah. We
lost Chris. Sorry. Let's go to line 1. I wanted to go to someone, Ruby.
This is Allison.
Allison is planning to get the vaccine. Line 7. Allison, good morning.
Good morning. Yes, I'm absolutely planning to get it. I had my boyfriend and my sister. They both got the vaccine. My boyfriend, I'm sorry, I forgot the names of them, but they each got the different types.
Moderna,
And they both
Pfizer.
had success with it. Yes. So they're both in healthcare. My boyfriend's working in Westchester Medical Center in the COVID ICU. So he's exposed every day. And my sister is actually in Texas. So her facility gave the other vaccine. And so they're both seeing a lot of success. And I really want to get it as well.
There you go. And now, what do you know here locally in the tri-state? I'm hearing that there's going to be these vaccination locations that are going to pop up, and it's by appointment only. Where if you work in a certain line of work, you'll be able to access getting the vaccine. I'm not quite sure where we are in that. Do you have any of that information yet?
There's I know New Jersey has like a waiting list you can sign up for, and I did sign up for it. I expect that I'll probably be one of the sooner vaccinations because I work in PPE distribution.
Yeah. Got it.
But yeah.
And do you know I think you said your boyfriend here in Westchester, did he get like a certificate of saying he got the vaccine after he got it?
Yeah, they get the little card with their, I guess, their bragging rights, and it just shows that they got it.
Yo, you gotta watch for that. They're gonna be asking for that card out here.
And here come the bootlegs.
And there's gonna be black market on the card. Shawnee, you got another one. Thank you for your call, Allison.
Yeah, we got Nick. He got his first Pfizer shot.
Okay.
Coming up.
Nick, you're on the schedule for your first Pfizer shot.
I got my first Pfizer shot. I'm going on the 25th to get my second one.
And how did you feel after the first one?
The first 12 hours, I just had a sore arm, and then I had a 101 fever, and I got destroyed.
And then you got a little sick, and then and they say that's a part of it. Your body's learning how to fight the protein.
Yeah, they say when you get the fever, that means it's working. So I'm not opposed to it. I'm excited. So
Appreciate that call, Nick.
Yeah, I think everyone should get it. I got crushed by COVID. I had pneumonia, so I think I was really excited to get the vaccine.
There it goes. Listen, we started the conversation by saying all the options suck, okay? And the reason I did that is because not that the vaccine sucks, but the fear that we all have and the lack of trust and the trauma that many of us have in trusting that this is safe. That sucks. I can't lie. It sucks. It also sucks that there's things that we just don't know, whether it be about the vaccine, the spread of the virus, if you've even gotten the vaccine shot. There's a lot there. So, I encourage people, if you have older people in your family, you need to be having a conversation about this vaccine. And if you have early access to the vaccine and you're someone who is an essential worker, you're out here driving, delivering in and out of people's homes, you could still bring that virus home to your loved ones. And so your loved ones may need to get vaccinated also, and you as well. Because black people are dying. It's very real.
If it means anything to anyone, I think she's my second or third cousin, Annette. She's a doctor. Ebro, she's the one who had reached out over DM and gave us some info about the virus and vaccine earlier.
Yes.
She just hit me. She says she's literally on her way to get the Pfizer right now.
So look, black folks, white people getting it.
Just so you know.
Let's be clear.
White people getting it. They're asking us to get it. They know we don't trust them. So as long as we clear that we don't trust y'all and we see white people getting it, I feel a little bit better.